Welcome back. For more on our top stories and others, please visit our website, channelstv.com and youtube.com/channelsweb. Log on to channelstv.com to watch us on your mobile device or download the Channels TV app for Android, iOS and Windows devices from their respective stores. The Channels TV and Channels 24 app will give you access to news and updates. You'll also have access to the Eyewitness feature, so you too can share those pictures, videos or news of happenings around you. Just install the app, then tap and swipe to reveal the menu and follow the instructions to share. The Enugu State Governor, Int'l, is reassuring international donor agencies of his unwavering partnership to ensure improvement in the health sector. He said this while flagging off the second phase of the 2018 Maternal, Newborn and Child Health Week at the Enugu State University Teaching Hospital, Park Lane. Governor Gwanyi says his administration will continue to give prime and adequate attention to issues relating to the health and well-being of the people.
According to the World Health Organization's 2017 report, Nigeria loses about 2,300 under 5-year-olds and 145 women of childbearing age every year, making her the second largest contributor to the child and maternal mortality rate in the world. In Enugu State, southeast Nigeria, the government says it felt duty-bound by the need to address the unacceptably high maternal and child mortality rates in Nigeria. Its partnership with international donor agencies for its Health Week is part of an initiative to explore the most effective ways of bringing it under control. The major objective of the Maternal, Newborn and Child Health Week is to educate mothers on the need to ensure that they and their children get access to good Medicare.
The state was able to achieve 82% coverage of children under 5 years of age in the first round of the program that ended in August last year, and has set a target of 800 children, about 95% coverage in this second round. I want to thank all the medical health professionals and other health workers who've been working tirelessly to improve healthcare delivery, especially as they relate to maternal and child health in the state.
The representatives of the World Health Organization and UNICEF are happy about the progress made so far.
I'm here to congratulate the government and people of Enugu State for the successful establishment of the primary care under one roof, which is now on board.
The donor agencies also commend what they describe as the remarkable growth and success attained by the primary health care system in Enugu State.
Well, at the beginning of the third quarter of 2017, the Cross River State government set out an agenda for its first health summit to revitalize the primary health care system within the state. The health summit was themed Translating Health Policies and Plans into Action and was held in view to create an avenue for the discussion of opinions of the people in the state to achieve universal health coverage. Months after that summit, there's been the emergence of viral diseases. Lassa fever is one of them, which the Cross River State government has confirmed that there's been 4 suspected cases, with one of the suspected patients being a pregnant woman who has been reported dead. Well, to shed more light on the Lassa fever situation in Cross River State, I'm being joined on the program by Dr. Int'l Asibong, the Commissioner for Health, Cross River State. Thank you for joining us on the program.
Good afternoon.
Dr. Asibong, last year the state government put in place a healthcare summit to revitalize the health sector. Well, are the measures put in place for to enhance health in the state not enough or not effective enough for there to have been an outbreak of Lassa fever in the state?
No, the measures have been very effective. The Cross River State Governor, Senator Professor Benayade, is very proactive about health. That health summit was the first ever we've had in the history of Cross River State, and it was very well attended by the Minister, the Chairman Senate Committee on Health, and the Acting Executive Secretary then of the Health Insurance Scheme. And following that, that's why we've not had as many cases. Remember, The present episode of Lassa fever started with our neighbor Ebonyi State, where we lost some of our health workers. Ebonyi actually borders Cross River State with some of our local governments. We've been able to put preventive measures in place to make sure that we do not actually get caught up in this. We've had 4 suspected cases. 1 result came back negative, thankfully. We are awaiting the results of the other 3. Unfortunately, like you said, we lost a pregnant woman, but we've already taken samples and we're already doing contact tracing for that particular index case. And we hope that these results come back negative.
Okay, while the results are being awaited, what's the state government doing to, or what's in place to curb the spread of this viral disease, especially with the other suspects? What's being done with them?
Yes, once there's an outbreak, there's usually an emergency response team, an outbreak team specially set up for this. We usually have meetings, daily meetings on this outbreak, and every day we get reports from the field because we have our disease surveillance and notification officers who carry out surveillance. These are the foot soldiers in the communities, and we have them across the 18 local government areas of Cross River State and across all the 196 wards in Cross River State. So we get feedback from the wards to the local government, to the state, to the epidemiologist, and of course to the Nigeria Center for Disease Control. And this actually happens on daily basis. We have these meetings also on daily basis. Now, the pregnant lady in question actually presented at the Naval Hospital first, and this is not the first time we are having a suspected case in a military hospital, so we decided to co-opt also the military. So in that outbreak response team, we have the full representation of the military in Cross River State, where we have our daily meetings and take steps daily, depending on whatever we hear for that day. We take steps to make sure that we curb it on time. Okay,
Dr. Asibong, sadly, the person that was lost to the viral disease, Lassa fever, was a pregnant woman. Another issue of concern is usually maternal mortality and maternal care. What's being done in that regard in Cross River State to also enhance? I know it was part of the health summit, some of the things discussed at the health summit. What's being done to ensure that the maternal mortality rate drops in the state?
Right now, in Cross River State, we have the free medical care for pregnant women and children. That's the vulnerable group. And we are coming up with something very innovative. The state governor is coming up with Cross River State Health Insurance Scheme, actually tagged Ayade Care. This is going to be the answer to universal health coverage in Cross River State. And we're actually targeting this vulnerable group of pregnant women and under 5 children. And presently, we are working on the wards, the primary health centers in our wards. We are trying to revitalize at least 1 per ward, and we are actually having this in clusters. We want to make sure that in every cluster, for now, there's at least a functional and operational primary health center. And these pregnant women and children can actually walk in here and access free medical care. And of course, there's a lot of donation of equipment going on by the Cross River State government, all in a bid to revitalize most of those facilities that the structures were already there, but they were not really functional. So what we are working on right now is mainly on functionality and operationalization, and we are trying to get human resource. We are right now recruiting midwives. There are going to be more midwives for these primary health centers. We're also doing what we call the task shifting and task sharing. In this, we are trying to teach the community health extension workers to do what before now was exclusively what probably the nurses or the doctors used to do. This is in a bid to make sure that no woman actually goes into any of these health facilities and comes back dead. Either we want to make sure that we have a healthy mother and a healthy child.
Okay, before I let you go, Dr. Asibong, is the state government also exploring sensitization campaigns to ensure that women are aware that this Ayade Care insurance scheme is in place for them?
Definitely. We're even going right down to our communities. We are doing a lot of advocacy, talking to the stakeholders, the opinion leaders, the gatekeepers in these communities. And definitely because we realize that these women actually listen to these people a lot. We're actually going even to the TBAs to tell them about making sure that they refer pregnant women to health facilities. And of course, in the health facilities, we are trying to give them incentives. We have what we call mama kits that we give because some of them complain that they do not have money to come to the hospital. Everything is free. Now we give them mama kits where they actually have things, everything essential. The essential needs for themselves and their babies, especially in that first 1 week. Everything is completely free and packed by the Cross River State government. We want to make sure that as many women as possible deliver. Because we've noticed that the number of men that attend antenatal in our health facilities are high up there. But when it's time for delivery, they actually still go home to deliver. So we are trying to work on this to improve these particular indices.
Very much, Dr. Inyang Asibong, for joining us on the program. Well, moving on now, when the program returns in a moment, Department of Petroleum Resources clamps down on airing fueling stations. Stay with us.